Hello and welcome. Today, we're diving deep into the world of kidney stones, also known as nephrolithiasis. These hard mineral deposits can cause significant pain and discomfort. Let's explore what they are, why they form, and how we can manage them. So, what causes these pesky stones? The exact cause is often multifactorial, but several factors contribute. These include dehydration, leading to concentrated urine, dietary factors like high intake of sodium, animal protein, and oxalate-rich foods, obesity. Certain medical conditions such as hyperparathyroidism and inflammatory bowel disease, and a family history of kidney stones. Some medications can also increase the risk. Now, let's talk about how kidney stones actually develop. It all starts with supersaturation of minerals like calcium oxalate, or uric acid in the urine. This means there's more of these substances than the urine can normally dissolve. These excess minerals then crystallize. These tiny crystals then aggregate and grow over time, eventually forming a stone. These stones can then lodge themselves in the kidney or urinary tract, causing obstruction and intense pain. Kidney stones are a fairly common problem. It is estimated that roughly 1 in 10 people will develop a kidney stone in their lifetime. The prevalence varies depending on factors like age, sex, race, and geographic location. Men are more likely to develop kidney stones than women. Also, the incidence of kidney stones has been steadily increasing in recent years, possibly due to changes in diet and lifestyle. Okay, what are the signs and symptoms of kidney stones? The most common symptom is excruciating pain, often described as the worst pain a person can experience. This pain typically starts in the flank, the area between the ribs and hip, and may radiate to the lower abdomen and groin. Other symptoms include blood in the urine, hematuria, nausea, vomiting, frequent urination, painful urination, dysuria, and urinary urgency. If an infection develops, fever and chills may also be present. How do we diagnose kidney stones? The first step is a thorough medical history and physical exam. If kidney stones are suspected, imaging tests are usually ordered. A non-contrast CT scan is the gold standard for detecting kidney stones, as it can visualize stones of all sizes and compositions. Other imaging options include X-rays of the abdomen, CQB, and ultrasound, although these may not be as sensitive. Urine tests are also helpful to assess for infection, crystal type, and metabolic abnormalities. While we don't typically classify kidney stones as stages like cancer, they are categorized by their composition. The most common type is calcium stones, which can be either calcium oxalate or calcium phosphate. Other types include struvite stones, which are often associated with urinary tract infections, uric acid stones, which are linked to high uric acid levels, and cystine stones, which are caused by a rare genetic disorder. The treatment of kidney stones depends on the size, location, and composition of the stone, as well as the patient's overall health. Small stones may pass on their own with plenty of fluids, pain medication, and alpha blockers to relax the ureter muscles. Larger stones may require more invasive procedures, such as extracorporeal shock wave lithotripsy (ESLL), which uses shock waves to break the stone into smaller pieces, ureteroscopy, where a small scope is inserted into the ureter to remove the stone, or percutaneous nephrolithiasis, a surgical procedure to remove the stone through a small incision in the back. Prevention is key to avoiding future kidney stone episodes. The most important step is to drink plenty of fluids, aiming for at least 2 to 3 liters of water per day. Dietary modifications can also help, such as limiting sodium, animal protein, and oxalate-rich foods. In some cases, medications may be prescribed to reduce the amount of calcium, uric acid, or cystine in the urine. A doctor or registered dietitian can help personalize a prevention plan. The prognosis for kidney stones is generally good, especially with appropriate treatment and preventative measures. Most people can pass small stones on their own or with minimal intervention. However, recurrent kidney stones are common, so it's important to follow a prevention plan. Recent research is focusing on developing new medications to prevent stone formation and less invasive techniques to remove existing stones. Nanotechnology is also being explored for targeted drug delivery to dissolve stones.